Welcome to the DaVinci Hour, a podcast series that interviews individuals across the field of medicine to help provide an inside look into their experiences and provide insight on how to navigate the journey of becoming a physician. My name is Dr. Maxwell Cooper, and I will be your host. This podcast is brought to you by DaVinci Academy, a medical education company that provides online video courses, outline format books, and clinical case videos for students studying the medical basic sciences. You can check out all that DaVinci Academy has to offer at www.dviacademy.com. All right, everybody, welcome back to the DaVinci Hour podcast. I'm joined this week by Dr. Patrick Beeman. Patrick and I actually went to the same med school, but a few years apart. We'll talk about, and then connected, I think, was it now 3 or 4 months ago now? And we've been producing some educational content, and I'm happy to have Patrick on here to talk about his clinical practice and then his, obviously, his very busy contributions to medical education at large. So, Patrick, welcome to the DaVinci Hour. I appreciate you coming.
Absolutely. It's my pleasure, honestly. So I don't know if maybe I was on the Physiology by Physio podcast before that was part of our network. But other than that, I have never been on somebody else's podcast. Thank you for this. Appreciate it.
I feel honored. I mean, you, as we'll get into, you are the podcast master in the medical education world. So very honored to have that. So why don't you tell us a little bit about, so you are both obviously a practicing physician and then obviously, do medical education. So maybe let's first talk about your clinical practice and give us a little bit of background on your education, your residency, and then kind of what your practice right now looks like.
Yeah. So in very broad strokes, I majored in philosophy and went on to get a master's in philosophy. Somewhere between undergrad and graduate studies, decided that maybe I should go to med school and kind of discern that. Went to UT, University of Toledo, College of Medicine, as a proud Ohioan. All of my education was in Ohio. Shout out Lorain County Community College and Franciscan University of Steubenville, Cleveland State University, and the University of Toledo College of Medicine. So Ohio, love Ohio, except when it's cold. Did med school, 2010, I graduated, went and did a residency in OBGYN at the Wright-Patterson Wright State University, also in Ohio, Air Force Base combined program in OBGYN, and did some, I was Ed Pellegrino's, this is a important aspect to my story, but Edmund Pellegrino, the chair of the President's Council on Bioethics, while I was a medical student in 2008. I was his fellow at Georgetown and got to learn under somebody who's been called the father of bioethics. So continued kind of my interest in philosophy. And I am like 2 classes in a dissertation away from a doctorate in bioethics or a PhD in bioethics from a school in Rome. But if I'm honest, I have not done anything with that for 6 years now. And so I'm probably going to have to re-enroll if I decide to go back because life is busy. And I somehow thought that I could do that doctoral degree while on my first Air Force active duty assignment out of residency to Scott Air Force Base in Illinois. And while starting InsideTheBoards, my podcast for medical students studying for the USMLE, which I launched in 2016. So I've been building that up, but clinically, I practice OB hospitalist medicine. So I am, you hope, completely unnecessary during the course of a shift. But 1% of the time extremely necessary. So, I do a mix of, ER calls and, labor delivery and obstetric surgery for common obstetrical reasons, do that now a few times a month. And I'm also the medical director of a level 1 opioid treatment program. Um, 2-year anniversary is this month, May 20th, that I've been doing that. And that has completely redefined um, my love for being a doctor and the way I look at this work. My day-to-day like professional enjoyment and satisfaction. I honestly, I cannot say enough good things about addiction medicine as a field, um, and the patient population that I get to treat in clinic. So I'm just gonna leave it at that because I I will go on and on.
No, that's a great overview, and I definitely want to get a little more into the addiction medicine thing because I think that's such an interesting field. As far as OB/GYN, the what made you want to pursue that field as a medical student? I think obviously we have a lot of med students listening, and what
Yeah.
what made you pursue that field back in your UT Com days?
Yeah. Ask myself that question from time to time. Um, you know, I think that the way I thought my career would go was that it would model Ed Pellegrino's. He was, truly a philosopher and a physician. He held dual appointments in the departments of philosophy and internal medicine at Georgetown um, for decades and decades. He was the president of the Catholic University of America at one point. But he was always a doctor practicing while he did these other things, including writing over 600 articles in peer-reviewed publications and making foundational contributions to the field of medical ethics. Um, and 14 books, I want to say. I believe he did 14 books, monographs as well, and did all that on a typewriter.
Oh wow.
Yeah, when I was there at Georgetown in 2008, um, I believe he was in his mid 80s, but still once a year he spent a month on service or something at on the on the wards
Oh
at
wow.
Georgetown University Hospital. Yeah, that dude was indefatigable and still wrote on a typewriter every morning. And so I thought, like, I really like ethics. I really like philosophy. I do not want to give that up, but seems like medicine's going to take a lot of my time and not really allow other interests unless they're integrated. And so what fields have a lot of ethical issues? How can I get that, dual academic appointment in a philosophy department and still practice medicine? And I thought, okay, it's got to be OBGYN. There's like literally uh, no one that I know who had professional training or expertise in both fields. And um, I found that a little bit frustrating because uh, going into medicine, it seemed like a lot of my colleagues, physicians, and those in training were not as all about distinctions as I was. Love to make distinctions and arguments and things of this nature. And a lot of the people I know in philosophy, in bioethics, especially when you're talking about fundamental philosophy, the stuff that people are easy to parody or turn into like a little like Sunday morning cartoon. But those questions of existence and what is knowledge and what is right or wrong, are those concepts that exist? Is there, all the big ones. With those, you're like they captured me so much, but I understand a certain like pie in the sky or ivory tower or out of touch, or there can be sort of transcendentalism that denies the reality of the here and now. Um, and so the people that I knew in philosophy often when they would write or talk about bioethics concepts, I feel like they wouldn't quite get the facts correct, um, or didn't quite understand the nuances of a particular clinical encounter. And for me, like, I'm a Catholic, so that figures big into like why I do medicine too, because like Jesus was kind of all about like healing people,
Hmm.
and trying to like, I'm part of that club. I kind of feel like I gotta, like try to follow that, the founder, his
Yeah.
his model, um, and so I'd get very frustrated by the sort of incessant debates between people who are on one side or another of a debate, when it would be clear to me that like the terms in which they were talking were at odds and equivocations. So there really wasn't any communication happening. And I thought maybe that'll be my contribution to, medicine and bioethics, would be to find some common ground for people who strongly disagree on fundamental moral issues. And that's because my mentor seemed particularly adept at um, confidently and skeptically, with great skepticism, holding his beliefs, holding true to his beliefs, while also, I don't think, making any enemies at the same time. And we're all trying to help people. At least that's what we say in our med school interviews, and I
Yeah.
think we should all be leaning into that. So hopefully that answers your question.
Yeah, 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 definitely. Um, when it came to OB/GYN, was it just like the mix of like medicine and surgery that you liked, or did you or that particular patient population and like women's, reproductive health and those types of things? Is that were those kind of playing factors in as well? And like you said, like all the ethical dilemmas that can come
Yeah.
with that as well.
So I would say, as intellectual subject matter, I always thought like the reproductive system and development, embryology, was just like really cool. I mean, I I don't know. It always struck me as just like this this what was that phrase you learn in like Bio 101? Ontogeny recapitulates phylogeny. Is that legit? I only know
Uh,
enough.
it sounds
I only,
familiar.
in any case, I don't know why that's popping into my head, but um, subject matter I thought was interesting, for sure. But what came to shape things was my third year medical school experience, in large part. I had had a hint of OBGYN might, maybe this is something I'd like, when I was an undergraduate, post-bac student at Metro Health. I did this thing called the Chester Scholars Program.
Oh yeah.
And yeah, Metro Health is like a half an hour from where both of us, our hometowns, right? Essentially. So it's
Yeah.
outside Cleveland. It's where Salk studied or invented, released the polio vaccine.
Oh really? I didn't know
Wait,
that.
wait. Maybe it was Sabin, but it's one of those. It's like
Hmm.
one of the few county funded hospitals left. But I shadowed this maternal fetal medicine high risk doctor, as this like 20-year-old kid. And he let me scrub, taught me how to scrub. So taught me how to wash my hands like a doctor does, and hold a retractor, and in a C-section. And I was like, this is so cool, so awesome. And it just like stuck with me, just the hands-on nature of it, as well. So I go to med school. I'm thinking surgery. I'm thinking probably pediatric surgery, because I think little kids are cool. I have my own kids at this point. Watching them grow and develop is like, just like keeps my interest. And you do some crazy cool technical procedures in ped surgery, but you also have to do like 10 years of it, including significant research. And I came to find out third year that I really did not mesh well with general surgeons as a group. They were not, as it were, like my people. Um, I would advise medical students, and I do now, like that finding, your people, the personality types that tend to go in the field that you want to go into. I think it should be pretty obvious, who those are, and one of the top things in your calculus on what specialty to choose. I would say a lot of OBGYN personality types don't fit me, if that makes sense. Although I have like, I was once told, I always tell this story whenever I get a chance, that somebody once told me in residency I had honorary ovaries. And so like I'd really try to play that up, I'm super sensitive and in touch with my feminine side. Um, but but I knew general surgeons were not my type of people, and their lives seemed too crazy. I did GYN onc at Toledo Hospital with Garth Phibbs.
Oh yeah, I worked with him.
He was amazing, like an excellent teacher, but that rotation did not prepare me for what GYN oncology was like. Even though he was a GYN oncologist, like looking back, I realized he had set up a gig that really was ideal for life. And he essentially, did all these like kick-ass surgeries like all day long, and he had a nurse practitioner who helped him round and do a lot of the paperwork stuff. And I believe he had to round on Saturdays, which didn't seem too bad to me. But when I did subsequent GYN onc rotations, I realized, some of the schedules, I mean, it was insane. I remember I did this like 4th year gen onc rotation at Walter Reed in DC. And like the GYN onc fellow, I remember getting at the hospital around like 6 a.m. And I remember him routinely being there till 8 or 9 p.m. at night on these rotations. And then the end of the rotation, also come to find out he had to cover and round every day and do cases at this other hospital, like concurrently. He's like, yeah, I just like before we come in here at 6 or 7, we go over to the other side. And it's not easy to get around in Washington DC. But I loved onc. I like being in tough situations with people. I mean, I may not look serious. I may not look like I have any social skills, and I was homeschooled for a large portion of my education. But I'm really comfortable dealing with bad news and when people are afraid. And so those are things that have applied really well in OBGYN, and which made me kind of like GYN oncology. But as I moved into residency, I realized I would not have been able to handle another 3 to 4 year fellowship after 4 years of OBGYN. It took its toll on me, frankly, mentally and physically to a certain extent. I've done some really cool things learned a lot of like awesome surgery. I've become, I still am like endlessly fascinated with like just motherhood as a concept. Like I am not selfless enough to do that job. And I see a lot of women, I mean, they go through some shit to bring us into the world. And even now, I just got back from my parents. That's why I was late for the call. I went over there and I'm like, man, I'm just thinking like, I really don't know how to appreciate my parents like I should. Um, but I do leave work every day and think like I am thankful that I do not have to go through so much that women do. Um, and I'm happy about the OB training. I especially love um, taking care of women with substance use problems because they don't really get treated that well at all, like doubly so. If you're using while pregnant, the judgment is judgment is strong and it is not helpful.
I can imagine. Yeah.
Yeah. Um, but yeah, I 1 week before the fourth year match when I had to submit specialties, I was still torn between psychiatry and OBGYN. And what I could not give up was the idea of doing physical exam and surgery. Like they're just two like things I really liked. And physical diagnosis skills I'm more realistic about nowadays, even as an obstetrician. Like obviously you can't really not check a cervix except digitally, and we don't really have scans for that. But when it comes to a lot of the other practical hands-on stuff, pretty much anybody who comes in with an abdominal pelvic pain presentation and is a female, um, with some very basic screening questions is going to go see you guys in radiology and get a scan. They're cost effective enough that they can give a lot more information. And maybe I'm in the like super minority of obstetricians, but I don't think I am. And surgery, man, I love surgery. Just it's so cool to be able to take something out of somebody that's diseased and see their pain go away. To you know I mean, the worst situations when somebody's comes in maybe with an abruption, like their placenta is trying to deliver before the baby, which is or can be like a significant emergency for mom or baby. um, and they don't even speak our language. They might not be from this country. Like those incredibly terrifying moments, um, I don't get too fussed about, and that's that's given me a lot of like satisfaction to be able to be that calm presence, and especially when people would make fun of me for being too calm. Like, yeah, that's right. I'm super chill.
No, it makes sense. I mean, the light seeking, both high stress situations, but also situations that, bring in your ethics interest. And then, like you said, the mix of medicine, surgery, it seems like OB-GYN was kind of a natural fit for that. I'm curious though, kind of going from that, and you opened with talking about it, was how did you get into now doing addiction medicine as part of your practice as well? And I guess maybe take a step back and give us, like, I'm sure anyone can imagine, but maybe like by definition, like what is addiction medicine? Like what is it that addiction medicine consists of, and who usually does, if there is like a typical specialty that does addiction medicine?
Yeah. So addiction medicine as a specialty is fairly recently recognized. It's so recent that, as sometimes happens before a specialty becomes its own, there's a transition period where people can become board certified in said specialty without having to do a residency or a fellowship, like training after medical school. Um, and this practice pathway, as it's called, is what I'm doing now, like trying to get clinical experience and studying, like we all do in medicine, continuously, and some other things as well. But to get that competence, You have till now 2025, I think, to be able to take advantage of a practice pathway. And I just honestly, in 2 or 3 years out of residency, um, I for a long time was spending weeks and weeks on call as the only OBGYN for like kind of a community practice, which wasn't as crazy hard and taxing as some of my private practice colleagues' lives I see now. Um, Being in the military, it was a little more chill, but still, I mean, a few times a week, I'd be like getting up at 1 a.m., driving to the hospital, coming back, and then have like a full day of clinic. And then, as my own personal character flaw, like 30 other projects and aspirations, like in writing or bioethics or starting a podcast. Um, and so I got pretty burnt out, actually. And I had known that as a second year residency, I just got along really well with patients who had substance use disorders. Like, they didn't annoy me. And, others would, sadly, and honestly, it pisses me off when I hear it now, but like, make negative comments about like another human being. Like, I don't get it, honestly. I never got it, um, because I know that like they need help, and that's what I thought we signed up for. But then I was in the military, so like over the course of 4 years of active duty, I think I saw one positive urine drug screen for something that shouldn't have been there, and it was marijuana. It's nowadays, like in the other practice environments, which have been multiple, to like university hospital setting, community hospital setting, outpatient substance use clinic. That one's more obvious, but I mean, everyone is positive for something. It seems, in a average community setting, certainly. Um, and I was just kind of reminded of, you know, this interest in mental health things. I'm not going back and doing 4 years of residency. And so, get out, long-winded way of saying, I get out and decide, hey, I can probably marry some of the interest in mental health with OBGYN by doing addiction medicine, because there's a lot of more focused, specific mental health related things. And I just always got along in OBGYN, like with patients who have um, disease states that have a significant psychological component, or really significant psychological effects, like infertility is a huge one. Like, couples don't get to the point where they're seeking treatment for that, and unless they've really suffered. But I mean, that's the truth. Like, OBGYN is great because of the breadth. I mean, you can do significantly satisfying surgery. You've got options to go into various, fellowships, and hone, this or that area. You see people from very young to very old. You can, despite the way modern medicine is going, and which needs to be restored, even more so, you still can develop meaningful relationships with patients to the point where you're like, yeah, yeah, I'm the doctor for you. We mesh together personality wise. And, I got to take part in this happy thing that you will experience a handful of times from, this angle, and we here working in L&D experience a handful of times a day, but still feel that, satisfaction. Like, yeah, like, cool, got this lady to stop smoking. This person, I got to help them optimize their blood sugar, and or um, I got to see them deliver a baby after treating them for stillbirth. when I initially met him, or difficult miscarriage, or all sorts of terrible things that can happen to people. So OB has strong strengths in its breadth, and having some of that mental health stuff and primary care. Like it is like every specialty to a certain degree. It's just all the patients are women. That's it. It's full spectrum of care, and that's what's cool about it. So
We're going to take a quick break to let you know the DaVinci Hour podcast is brought to you by DaVinci Academy, which provides online video courses for the medical basic sciences. These courses are taught using a variety of teaching methods, including bullet point outlines, diagrams, radiology images, and chalk talks to explain the fundamental concepts. We then teach the application of those concepts to numerous clinical pearls that are frequently tested on medical school exams and the USMLE. Our video courses are available on our website, dviacademy.com, as monthly subscriptions starting at $9.99 per month. Each video course has a corresponding outline format textbook as well. You can find the link to our website in the description below. Also, be sure to use the discount code TDH20 to receive 20% off any of our video courses. All right, now back to the podcast.
I want to come back real quick though for the addiction medicine piece. Is that, I guess, forgive me just because I'm not as aware, is that like, are these physicians that work at rehab centers, or is it more on an outpatient basis, or is it both? Or are addiction medicine specialists ever brought in on the inpatient side to deal with things like that of that nature? I guess kind of what does that all entail?
Well, yes, basically to all of those things. So, if you're a fellowship trained addictionologist, which is the term for people who come to addiction medicine outside of psychiatry. So there are a couple of ways to become an addiction medicine doctor, or primarily work as a physician in the context of addiction. You can do a fellowship from psychiatry and become an addiction psychiatrist. You can, like me, have a primary board certification from the American Board of Medical Specialties. There's 20 something of those. And then get enough clinical experience to practice addiction medicine, get board certified, or you can go on to fellowship from any ABMS specialty. And what do they do? Well, buprenorphine or MAT, medication-assisted treatment, or now we're trying to go towards medication for opiate use disorder. There are, quote, Suboxone clinics or methadone clinics that will help people with, a substance use problem for namely opiates get on what effectively is a rehabilitative therapy for their brain, to kind of help them reboot and get back some of the, rebalance some of the things they may have lost from years of having this disease of their free will addiction. But addictionologists and addiction psychiatry folks will work in inpatient rehab centers on behavioral health units, for the psychiatrists especially, for inpatient psych. They will supervise medical, like detox centers, like when people go to get like medicines to help them go through like opiate withdrawal. A lot of policy advocacy work, or niche, sorts of things like helping fellow physicians or providers who have substance use problems, or pregnant women, setting up programs in the community, or a clinical system to deliver prenatal care and treatment to pregnant women. helping manage alcohol withdrawal, providing consults to physicians who suspect that a patient's whatever condition is significantly exacerbated or caused by their substance use problem. Pretty much every clinical, standard issue clinical context, addiction medicine physicians work within. So they're honestly the coolest doctors. Like, I mean, I know orthos probably think they are, maybe. Definitely a lot of ED docs think so, at least the ones I know. Um, but honestly, addiction medicine docs are the coolest. And I can say that now without like tooting my own horn because I am not board certified in addiction medicine. I'm trying to get there, but I am not. You got to do an addiction rotation. Like if you're a medical student, I highly recommend it because I mean, think about it. Like every single specialty is touched by addiction. Like, I mean, you can get infectious disease has a lot of work that happens because of substance use problems. Certainly, psychotic disorders in psychiatry, abruption for cocaine use in pregnancy. I mean, acute angle closure, glaucoma. The ophthalmologists even do. I mean, it's everywhere. What about radiology? What's a good radiology example? I mean, the falls and broken bones you probably see.
Yeah, and then
That or
yeah, and then interventional, for abscesses, if we put drains and
yeah,
abscesses that form and things like that. Yeah, no, definitely. And I don't know if I told you, I did my intern year here at Emory, which a big hospital we covered is Grady Memorial, which is kind of like the metro of Atlanta, if you will. It's
yeah,
a big, huge county, 1,000 bed county hospital that treats a lot of the underserved population of Atlanta. And down here, up in Ohio, that's, as you know, the opioid pandemic has certainly reached up there, but down here it's definitely down here, but there's also a significant crack cocaine issue as well with a lot of our patients here. So I did a lot of rotations in medicine, emergency medicine, and so we got to kind of see the effects of that. And what you say is true. I mean, it affects so many different aspects of people's care. I mean, sure, they come in with heart failure, but you got to think about, why did they come in with heart failure? Well, if they relapsed,
violated.
yeah, and took cocaine
Totally.
again, yeah. um
Yep, exactly.
so it's not just, oh, so and so has a problem. It's much more complicated than that. It's part of their treatment plan. It's not just, in that case you diurese them and send them out. They just, to get a long-term success, you need to address this other underlying, health issue.
Yeah. I mean, absolutely. It's like it should be intuitive. And, what I have been so struck by, and like I said, this is going to be my second anniversary of working like specifically dedicated in the field on May 20th. And what has struck me is the stories of people who acquired the natural history of it. Like my clinic is an opioid treatment program, so everybody I'm seeing is this one disease. They at least have that, and I just watching the development of this problem and seeing which people get better based on their personalities or the things they're doing, their attitudes, their life experiences, their comorbidities. Hearing the stories of how they got the addiction, um, and developed it, how it's like a switch flips, and my doctor started me on Percocet for my knee pain or my back pain, or just post surgically for a couple weeks. And unlike you, Dr. Beeman, like when you take Percocet, you're like, I have nausea, I'm going to throw up. Like it felt good to me. And, I thankfully I never had that, because for others, once that happens, it initiates a cascade of events that really negatively can affect their life. Everybody's going to get dependent on opiates if you take them long enough. Um, but when you then go to switch insurances, or you're being prescribed something from an unscrupulous doctor, or just somebody who isn't thinking, like the orthopedist who does a knee, case, and the your standard issue, like retired cop who, uh, many of us know. I have a family member like this who, he had a post-surgical complication with his knee, and it hurt. I mean, it was like he had this huge effusion, um, a week out from his case, and so he needed more pain meds to control his pain. Totally reasonable. But then he also developed a week later, like an infection, like a septic joint, after having like this fluid drained off. And so now it goes week and week on till like 4 or 5 weeks. And this, family member who was a retired cop, so that often can tell you a lot about what they think about, drug policy and things of this nature. Uh, was like, I don't know if this is helping me, and he was starting to have like anxiety, like 6 hours after he'd taken his like last Percocet, for instance. And this is somebody who does not do drugs, recreationally.
Hmm.
Um, and it was just very striking to see him. He was dependent, and he could easily have developed an addiction because those doses escalate. You go from Percocet, you do that 3 months every day at a decent dose, then gets cut off, stop cold turkey because your doctor cuts off the prescription. You're gonna be sick. Like it looks like literally shitty, if you excuse the language. But another pro of addiction medicine, patients probably don't mind as much as if you swear. So,
Gotcha.
yeah, but yeah, I mean, it just sucks because our profession, we physicians should be the leaders in healthcare. We should be steering the ship. We should be remembering, like, there's a reason why our domain and expertise is oriented towards human health, a basic primary good of the human person. And instead, we are employed by systems that try to dictate to us what we ought to be doing when they can't understand what it is we actually do. There's that disconnect between the ought and the is. And really only we can remedy it within our spheres of influence and stop, you know, trying to see a bajillion patients in one day, and, you know, catering to systems that won't let us treat somebody adequately, which might mean getting involved in treating their addiction, even though it might take a little bit of like work and advocacy and, just small things. It's super high yield, as it were, for community support. Like, I have so much Narcan now, I just like give it to everyone. Like, my county had, I think, 220 overdose deaths last year, somewhere around there. And like, I went to the county like memorial service, and I mean, it was just like heartbreaking. Like, I don't know, you can't get through it. I honestly, I could talk so much about addiction. It's like so fascinating to me, and I have like awesome patients, and I mean, they're like really tend to be, I think, on average, more intelligent than your average person, personality wise. A lot of them tend to be really, really creative compared to age match controls who don't have these genes and these tendencies and environmental circumstances that brought them to these points. And people who beat an addiction, like when they go to like start a company or in engage in like a creative endeavor, I mean, there's some of the most important contributions to all human enterprises. They can be. So I don't know, I can't. I will keep talking about this.
No, no, that's no,
Yeah,
it's
I'm
fat.
pretty passionate about it. So
No, it's a fascinating thing. And I mean, I'll just even say, as you're talking, hitting all fields, you mentioned orthopedics. The other thing with our field has done a lot of, and which is really exciting in interventional radiology. And then there's some anesthesia docs also doing this as well, as like pain interventions to help get people. And essentially a lot of the goals with those, like kyphoplasties or some of the other kind of nerve ablation procedures that we've done. I just had a guest on who's an attending at our program that specializes a lot in like nerve ablation for pain, and he has these patients that have chronic pain and reach out to him from all over the country and come here to see him and get procedures done. And because they work, they do, and it's again kind of our specialties kind of crutch, if you will, or not crutch, but challenge is to get people to realize, like I think I've told you, is that we have other solutions than just, and in this case, we have other solutions than just taking opioids or pain meds, or suffering through it. That's kind of a main goal, is to help people get off of those and also have less invasive, avoid less invasive or more invasive alternatives with surgery. So yeah, no, it's definitely, I think attacking that from all angles is definitely really fascinating. So we've covered your clinical practice. I want to definitely get into your other passion in medical education. So you were obviously one of the early people at OnlineMedEd, which has exploded into, a huge, online medical education company and resource, worldwide. So maybe kind of take us through your journey through the kind of the medical education world, OnlineMedEd, and then obviously, InsideTheBoards and where you are now.
Yeah. So as a medical student, coming from philosophy, I had to change the way I studied. And I figured out that doing practice questions was the way to go for exams, and started writing content along those lines as a fourth year medical student. Continued that throughout residency. Like I said, I was the director of content for a osteopathic question bank for a while, and then I've written thousands or edited thousands of questions. Started InsideTheBoards in 2015 because what I had learned, I think, through writing all of these multiple choice questions in a National Board of Medical Examiners format, and really staying steeped in their authors guidelines, that you could take the principles of good, knowledge evaluation or test taking, ideal, item construction, and then apply it to your study. That's really, what helped me be able to go from like 20th percentile standardized exam scores on like shelves to 99th percentile once things kind of clicked, and I weighted everything basically towards doing multiple choice questions for study purposes. I figured you could teach that to people. They didn't have to get a job doing it. And that's why I started InsideTheBoards, because I was hoping, like, here's this. I'd come out of like this burnout and had some significant mental health struggles, acquired a pretty decent facility in writing questions and teaching people how to answer them. And so I started the podcast 2016, just kept doing it. Got to early on, one of our guests was Dustin from OnlineMedEd, one of our earliest guests, and one of the best, honestly, interviews and episodes I ever did for this thing in the past 6 years. Really is a really interesting character, Dustin, and has his heart in the right place. Really, honestly, everybody did it at OnlineMedEd, like as a company, just really, they're worth supporting. Like I wanted to be a part of that through my work at InsideTheBoards. Meeting Dustin, I got to spend a year as the director of undergraduate medical education. So essentially the question bank guy. Once I got out of the military and moved back to my hometown near Cleveland, Lorain, to be near my kids. And then subsequently, Inside the Boards has grown from one podcast to uh, like, I mean, 7 or 8, depending on if you join our network. So, um, so yeah, so we produce shows for mainly students studying for step 1 and 2. We have 2 original ones, Inside the Boards, the main original OG podcast, which is um, mainly interview based. Still, with each episode, we try to break down one multiple choice questions, kind of help you to think like a question writer. We have a straight up, like, all question breakdowns show called the Study Smarter podcast. We produce a Physiology by Physio show from the guys at Physio. Um, One of my partners in Inside the Boards, Ted O'Connell, wrote Crush Step 1 and the recent editions of USMLE Step 2 Secrets and Step 3 Secrets, plus a bunch of other things. We have a podcast version of USMLE Step 2 Secrets and Crush Step 1, Ted's books, as well as another Elsevier title series from Dr. Raj. That's Raj Dasgupta, called Beyond the Pearls. His series, Beyond the Pearls, or Morning Report, all case-based, long-form, breakdowns of clinical situations for testing purposes. Yeah, so trying to add some more. And with Inside the Boards, honestly, it's 22, May the 2nd. We've made more progress as an organization and a company. I've matured a lot, I think, as a leader in the past 3 months, probably, than we have since the beginning, when we really took off in that second kind of or third wave of podcasting in like 2016. Nobody was really doing USMLE prep podcasts, which was like, I was like, what? Like, that's crazy. Now we, have sometimes up to like 100,000 downloads per month on our network. And ended up founding a separate health media endeavor called Ars Longa Media, so that I could do like media podcasting work outside of just medical education. So I actually have like more like 20 podcasts in production or live, and trying to add more to create, unified some content around addiction stuff and mental health, destigmatization, restoring, the kind of humanism to medicine by philosophy content, and importantly, coming soon, the audio sketch comedy for healthcare, Code Periwinkle, which is going to be like SNL meets Grey's Anatomy meets John Oliver, or some other interview-based late-night show, but for medicine and on audio. It's going to be hilarious, I hope. And it's going to be built by all the listeners, along with us who devote some of our professional time to this work.
One thing I wanted to ask you, just so the listeners are aware, you have a paid or a premium membership on your website and your app as well. What does that offer those users?
So we have a premium subscription to Inside the Boards, gives access to our all audio question bank for either the USMLE Step 1 or 2. That's kind of the core content or product that we offer. And then we uniquely also, within our premium membership, have like the high yield 100 pharmacology questions from Lacturio, and an audio version of Khan's Cases, Medical Ethics 101 for the boards. And a lot of that's going to be revamped, though, so that's coming soon too. I'm constantly trying to think of ways to ensure that we can continue to pay the people who work for us, and also though save med students money, because I hate having to charge people, but you do have to pay to develop an app and maintain server storage and some like practical things like that. But I think we're close to figuring out a way to make it like super cheap and accessible, and to ensure that any money that goes to Inside the Boards, people know why it goes to Inside the Boards, where it goes, and feel that the value that they're getting just goes beyond the some audio. but we are trying to produce things that help you study on the go, save you time so you can redeem it for your family, have your priorities set so you don't develop an addiction or mental health problems or relational catastrophes, and some of the things that people in medicine can be prone to that really should not be the case. So
Sure, sure. And I think going on that, I'll take a minute to kind of talk about what you and I are doing together with between DaVinci Academy and Inside the Boards, where we're building we have our weekly case series, DaVinci Cases at DaVinci Academy, which some of the listeners are probably aware of. But we're doing our Inside the Boards edition, which is basically Patrick and I joining forces to bring you that question dissection skill set that he has crafted so well on his podcasts, and then obviously we've been able to do on our DaVinci Cases. And so we've released a few episodes already, and then I think that's going to be we're still working out the further details, but we're doing mainly pathology cases right now, but we hope to expand in other subjects, including Patrick's passion for ethics, and then making that also a kind of a add to the paid value as well of both paid users on your platform and on ours as well. So more to come from that.
And we're trying to do it kind of open too, because like this is, hopefully we can be able to demonstrate that a cooperative approach inside the market, as it were, is worth pursuing more than the fierce competition that keeps us from accomplishing as much as we could. We all see it in med school, but that doesn't need to continue. Like we're leaders. We're going to be, significant players in our communities. And if we do it together, that can really change communities, honestly.
Sure. So I want to kind of finish on that. Ars Longa Media, I think, is really cool what you're doing with that, where, like you said, you've kind of used that to expand outside of just medical education. I guess maybe tell us a little bit. So you have your Inside the Boards podcasts on there, but what other types of podcasts do you have on this? And is it like are you trying to form this? I think the way you've described it to me is almost like an Amazon Prime of podcasting, if you will, or in the kind of medicine and health and wellness type space.
Yes. So Ars Longa Media is a health media and creativity company. We want to operate wherever health broadly considered, not just a more narrow medical or biological definition, not even just mental, but health broadly as possible, wherever health and creativity intersect. Because, I won't get into everything, but quickly, the Ars Longa Vita Brevis is a Latin term, usually translated as art is long, life is short. And it is, a lot of people don't, elementary Latin 101 people, when they see this, don't realize that it's attributable to Hippocrates. So the art that's referred to there is the art of medicine. And being a doctor, it made sense to me to call it that, being somebody who loves Latin, or loved Latin when he had time and could learn it in an undergraduate context, had to have a Latinate name. Absolutely, the company had to have a Latinate name, not compromising on that. For anybody out there listening who has tried to convince me that it should not be a Latinate name, you are wrong. Everything else we can collaborate on, but that's my hardline boundary. So art is long, life is short, or as more loosely, art, creating stuff, creative endeavors perdure or endure beyond the brevity of life. And that goes to, making lasting contributions, hopefully important contributions to somebody's day, whether Code Periwinkle brings them joy and respite from the, stress of modern medical practice. We are producing content from Inside the Boards that helps somebody pass their USMLE and become a doctor, while saving some time for getting their own oil changed or getting a health maintenance exam at their own physician. But yeah, so we create content in mainly 3 areas right now. Medical education, Inside the Boards is the bulk of that. More general healthcare things, like we have a show on our network, was an early COVID podcast, because we knew that fight was, the information fight was going to be critical back February and March, and Ted O'Connell did a lot of work as a host of that show early on. Obviously, nobody really, it seems, cares about COVID anymore, and we've really made progress against that. It was tough 2 years, tough on our families, on our individually, tough on these businesses. We have medical news by medical students in the Health Beat podcast. So healthcare, med ed, and mental health. So mental health and psychology, we have content right now mainly focused on healthy relationships. So there's one called Healthy / toxic, because that looks cool. All about like toxic relationships and relational dynamics, which also learning that stuff super useful in medicine. So healthy toxic, true crime psychology, and a cluster B personality disorder podcast. We're going to be moving into the music space and producing a show with a psychologist who has a music and mental health podcast, and going to be doing an addiction related season on that. I can't wait to tell people about that one, but I can't yet. So music, philosophy, I would like to get into. More to come on that, along with a Inside the Boards bioethics and health system science series. And aliens. I would like to get into aliens too. Not really, but I do have an idea for a show called Aliens and ... But I will not go into that now. For more information, go to Tom DeLong from formerly of Blink 182 and now of Angels and Airwaves. He can fill you in on that. So.
Awesome.
Great. Now everyone's gonna think I'm into aliens and crazy. Think I'm crazy because I mentioned aliens, rather than all the other things I just talked about, trying to do at once.
No, you're certainly a very busy guy, and it was really interesting. Obviously we've been communicating pretty regularly for the last few months, with our different projects and getting to know each other. But it was great to hear your story on both your clinical background and then obviously in medical education. And thanks for sharing that with us and your pearls of wisdom that you've picked up along the way. I guess we ask every guest this just to close out: when you're not doing all of these projects and practicing OB/GYN and addiction medicine, what do you do with your spare time? How do you because we kind of try to foster that outlet if you will.
Lately, home improvement, like laying flooring. So that's just a necessity of this current season in my life, but trying to get back into guitar. I did 9 years of classical guitar lessons growing up. But honestly, my go-to thing, I love video games. I really enjoy video games. I got an Oculus, which is crazy. and I have a PS. Honestly, I have like all the game systems. I try to play at least once a week. Not always successful for like an hour or two. And then about every like 6 months, I'll spend like a week just like binging, and doing that with all my free time. And I don't know, it's a guilty pleasure, but I like it.
Awesome. Well, we'll definitely put links to, Inside the Boards, Ars Longa Media, in the show notes. Is there, if people want to reach out and, collaborate or want to, get involved in producing content for Inside the Boards or Ars Longa Media, what's the best way for them to do that?
Well, what I would say is you can send me an email, Patrick at arslonga, that's ARSLONGA.media. You just Google Patrick C. Beeman, include the C in there as a middle initial. Trust me. If you don't, the other person is not me. Now everybody's gonna Google it. But you'll see. I showed this to you, right?
Yeah, I think yeah, there's
D. Beeman is a way different from Patrick.
Yeah,
C.
I think you have a YouTube video on this on one of you.
I might.
Yeah,
maybe that might be true. That sounds like me. And yes, that is true. But yeah, so yeah, just reach out. I can't promise I'll get back to you in a timely fashion, but I will try to get back to you or have somebody get back to you, if I myself can't. So
awesome. Well, Patrick, thank you again for coming on the DaVinci Hour. Appreciate it. And
thanks for the conversation. I do enjoy our conversations, and it is nice to be able to talk about myself for an hour and a half. Like, it's kind of weird, actually. I haven't not done this in a while, so hopefully I didn't bore you to death. I definitely appreciate the opportunity, and can't wait to see what else we keep doing week by week.
Absolutely. Yeah. So, all right, everybody. Well, this will close out our conversation, and definitely keep your eyes out for the DaVinci cases, Inside the Boards cases coming out soon.
Thank you for listening to this episode of the DaVinci Hour, brought to you by DaVinci Academy. More episodes are available on our website at dviacademy.com, our YouTube channel. They're also available on Spotify and Apple Podcasts. Also on our website, you can find our video courses for anatomy, biochemistry, and histology, and they're available as month-to-month packages. They're also available as a combo package where you can get all 3 courses in one. Our website also has a store where you can find our outline format textbooks for anatomy, biochemistry, and histology. All textbooks are available in paperback version and as ebooks as well. These textbooks complement our video courses and provide a nice addition to the learning experience of allowing you to focus on the learning and not having to write anything down. On our website, we also provide a free clinical cases video series called DaVinci Cases. DaVinci Cases aims to help you learn how to answer USMLE questions and apply concepts that you learn in our courses to answering those questions. Our cases cover a variety of topics and organ systems, and they're updated frequently with new cases. And then lastly, on our website, you can find our blog, which has interesting articles that cover medical history, important figures in medicine, and innovations in medicine. Again, thank you for listening to this episode of the DaVinci Hour, brought to you by DaVinci Academy. Please be sure to tune in for our next episode.